If you wanted to they were if you were to show up in a word count, like if you invited you to speak, you should have said, hey, I would just miss you. You need to be on the roster for 10 or 15 minutes. No, they just show up and invite people. So sometimes Sunday school teacher,
Yeah.
Depending on what they want. It's like the emergency we got you waste your time if you as opposed to if you're missing oh, it's gonna be this. Okay. I want to give them a heads up. These are the questions I'm going to talk about. Because then, if there's some forethought when everyone's sitting down, that's not the time to start things. You know what I mean? That's the time to present. Oh, that's true. I guess it depends if you want feedback.
I don't think I want that feedback.
Okay, testing. We're going to use the microphone for Q&A tonight, just so that the broadcast can pick it up. So, and then Nate will present without a microphone. So that's why we're using these. First of all, thank you, Brother Boyle, Nate Boyle here. Let's give him a big shout out. We've been planning him for a while, and we're just so thankful.
We'll see if you're still clapping afterwards.
He's super qualified, got a lot of experience, and a big heart as well. So if you don't know him, maybe you'll learn a little bit more about him tonight. But just a reminder, we have one set up it's March 1st actually. That'll be a gardening and a tree pruning one as well. It's like two mini classes, 2 half classes. So that you can look forward to that. I'll send out the details on that. Also, don't forget about our YouTube page. A few of you have asked. We're trying to get these uploaded. We have 4 uploaded. We have 1 more we need to do, and then this one should be uploaded as well. So just a great resource to go back and look at when you get a chance. Also, we want this to be simple, right? We don't want it to be overbearing. We don't want it to be, complicated. We just want thought starters, right? Maybe some action items, so that we can go home and maybe move on that the next month or so until the next class. So that's kind of our goal. We don't want to be overbearing at all or complicated. So, okay, I'm going to open with prayer since I forgot to ask someone, and we'll turn the time over to Brother Boyle. And also, one more thing. Thanks for coming. I heard there was a big game. I totally forgot about it till last night, like at 4 o'clock, someone texted me and said, hey, I'm not coming because of the game. Wasn't even on our radar, so.
It's not very exciting.
It's not very exciting, that's what I heard.
Yeah.
This is going to be way more exciting. So. Anyway, thanks so much. I'll go ahead. Our Father in heaven, we're so grateful to be here tonight. We're grateful for each of the members here and for their willingness to learn and grow. We're grateful for Brother Boyle and his willingness to share his knowledge and his experiences with us. Please open our minds and our hearts with the Spirit that we can be inspired to know how to act and what to move on in our personal lives at home as we return home tonight. That we'll be ready and able to make the changes we need. We're grateful for our Savior. We recognize Him as our elder brother. We're grateful for these things, and we ask them in the name of Jesus Christ.
All right. Well, I think I'm plenty loud. I don't think I need a microphone. So, my name is Nate Boyle. I have worked in emergency medicine for a long time. I've been a nurse practitioner for about 14 years. I work at both hospitals, both at Ermac and Idaho Falls Community Hospital in the emergency department. Before I was a nurse practitioner, I was a nurse in the emergency department and started there way back in Sacramento, California. Worked in a trauma center there, and then I've been here since 2008, working at Eastern Idaho Regional Medical Center, and then just recently we started working at Idaho Falls Community Hospital. So I do have quite a bit of experience in emergency medicine. Again, we're going to kind of go over some brief stuff. I am not, in fact, I'll go on to the next slide. This is not a CPR certification, okay? So just realize that. How many of you have ever taken a CPR class? Good. So there's plenty of you out there that have taken a CPR class, which is fantastic, and that's something that I would recommend that you do, is go take a CPR class. We're going to go over stuff kind of briefly and vaguely today, kind of what to do in emergency situations. We'll talk about wounds, we'll talk about fractures, we'll talk about burns, we'll talk about all different stuff as well and how to treat that. As far as CPR goes, I think it's really important to go get certified, especially for parents, grandparents who have kids, grandkids. You need to know what to do in a situation if something bad happens. Yes, please.
I need to go recertify because the things that I learned 15 years ago
They're different.
changed.
They're different, yeah. What's nice is they've kind of standardized everything, and we'll talk about that a little bit as we dive into some stuff in some of these slides, and so we'll talk more. I want to thank Sister Grimes. She brought some extra equipment here for me to show off. Ambu bag here. There's a splint. There's some C-collars that you can put around a neck. Now, again, this is nothing that you guys probably need to have in your equipment or your first aid kit. This is something that we'll dive into a little bit more. I brought this first aid kit. I think we got this at like Sam's Club or Costco, but it's got all the essentials in there. I brought my friend here that we can actually get some practice on. What's nice about this one is there's lights in the shoulder, so if you're doing correct CPR, there's 2 green lights in the shoulder that'll show if you're doing correct CPR or not. So you guys can come and practice with that. I brought some Ziploc bags that you can put holes in so you don't have to share each other's slobber. So it should be fun. Okay, so again, this is not a CPR certification. This is kind of just the nuts and bolts of CPR. So when do you give CPR? Obviously, unresponsiveness, not breathing or gasping, choking or difficulty breathing. We'll kind of dive into the specifics of this. The number one thing for CPR when you arrive on the scene, if that's somebody down or if you see somebody go down, is safety first, right? If they're in a puddle of water with a power line, obviously you're going to avoid that situation, right? Safety first is the biggest thing when it comes to CPR. So check for safety. The number one thing to do, and President Garano, I don't think there's AEDs in the hospital. So everybody know what an AED is, automated external defibrillator, okay, which is it's a little thing that you can attach stickers to the chest, and it will read heart rhythms, okay? I'm going to squash kind of the misnomers and some of the things out there. You cannot shock someone that doesn't have a pulse. It doesn't work, okay? The Tom Cruise movie, whatever, he has no pulse and they shock him. Doesn't work that way, okay? It doesn't work that way. AEDs only read it if you're in some kind of a weird rhythm, which happens, but most of the time it's asystole or no heartbeat at all. And so AEDs, there's not one here, but that would be the number one thing to do. So again, number one thing to do is if you see somebody that's down, and I'll just kind of go over what to do, right? So I see Herman here is down, okay? So I run to him and I shake him and I say, are you okay? Are you okay? Okay? That's the number one thing to do. Again, I'm checking for safety. 2 fingers on the carotid pulse to check for a pulse. Do that for about 5 or 10 seconds. You can bend down and see if they're breathing. You can see if their chest is right and if they're breathing. If that's not happening, then you give very specific commands. So I'm saying, Nathan, go call 911. Brooke, go get an AED if there is one. Okay? Very specific. You're not just saying that out in the ethos. You're being very specific and giving directions on them where to go, and then come back and tell me what's going on. So again, first thing to do, check when the person is breathing effectively for about 10 seconds. Then if they have no pulse, you want to start CPR. Okay? Who has ever had to give CPR besides prison guard? Okay? A few people have. Hopefully it's something you never have to do. I have way too much practice in it, and it's hopefully something you never have to do, especially in kids. So first thing to do is to find, you want to place your hands in the center of the chest. We'll talk about adults first. Infants are different, and children are different. So place your hands in the center of the chest, between the nipples, and you want to put your hand right in the middle there, other hand on top, and then I'm getting 2 green lights. Oh, maybe I'm not doing it good enough. So you want to press down hard and fast, 100 to 120 beats per minute. That's pretty quick. I don't think you guys realize how fast that is. Most people give very ineffective CPR. They're like this. They don't go very far down when they're giving CPR. They're not hard. This most of the times cracks ribs. We have what's called a Lucas device that we use now. And it's actually a pump that we put the patient's hands up on it, and it pushes down on their chest for us to give CPR. It's kind of barbaric, but it works. Okay? So place the hands in the center of the chest, above the sternum, between the nipples. Push hard and fast, 2 inches deep. And you want to do 100 to 120 beats per minute. So the normal way of doing it is 30 compressions to 2 breaths. So, and there's different ways of doing that. Now, if you're not comfortable doing 2 breaths, just chest compressions is fine. At least you're doing something. So I'm going to show you here. We have this cool mannequin. So I'm going to put a little hole in one of my Ziploc bags here, so I can give. And you can see it here. So this is what's called a head tilt chin lift. Okay, so I'm bringing the head back to open the airway, and then I do 2 kind of longer breaths. So here we go. And as you're doing it, you want to see the chest rise. So there's 1, listen, 2, and then you go right back to resuming CPR. So the way to remember this and how fast you're going is if you sing, staying alive, ha, 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 staying alive. That's the correct rhythm, okay? That's the correct rhythm. Okay. Questions? Anybody? Comments? Yes?
Do you have to tip their chin like way far? Sorry. Do you have to tip their chin like way far back?
To open the airway as much as possible. Now, if you breathe on that too, and there's nothing going through, thank you. Not had a table. So if you do that and you do not see chest rise, re-tilt the head and try again. There could be an obstruction in the throat. That happens. So re-tilt and go again. Okay? Other questions before we move on? We're going to keep talking.
The church is just this year approved to put AEDs at girls' camp.
Oh, nice.
The church is going to put AEDs at girls' camp and the Trek site and all of those places. I think I've seen them in the conference center, but
It's hard to do in a church building just because of the upkeep, right?
And there's too many deacons.
Right. Oh yeah. 100%. 100%.
Hey, am I authorized to use an AED if I have no idea what I'm doing?
You are. They're actually really simple. When you open up an AED, and I wish I would have brought one. When you open up an AED, there are instructions on there how to use it. It tells you where to put the pads, and you just turn it on, and it is easy as pie to use. You turn it on, it says stop. Well, you want to keep doing CPR until those pads are placed, and then it'll tell you stop CPR, examining rhythm. So once you get those on, it'll examine the rhythm, and then it'll say either resume CPR or shock advised. If shock is advised, it tells you to step away, and it'll administer a shock for you. It's fantastic. They're really cool. I don't know if anybody's ever seen one, but they're pretty slick. They're in more and more places nowadays. You'll see them in restaurants. You'll see them all over. But again, the upkeep of them is kind of hard because you got to check the pads, they expire and things like that. But very easy to use. Very easy to use. So if you have an AED, it's ideal if you could use one. But if not, CPR is there.
How about a drowning victim? A drowning victim.
Yes.
How do you help get the water?
Same thing. It's just resuming CPR. Obviously, you're not going to be able to get water out of the lungs. We'll talk a little bit about this more further. That's almost like a snake bite. It's almost like that, oh, I'm going to suck the venom out. No, you're not. You're just going to kill yourself. So you're not going to get the water out of the lungs. If they have no heartbeat, it's just doing CPR. Now, if they start to cough or anything, obviously you lay them on their side and try and get that water out. But it's just CPR and chest compressions like usual. Yeah. Okay? Other questions? Okay, so when to use CPR and when not to. Obviously, not breathing or breathing. Infant or child when they're not breathing normally. Heart attack, near drowning, suffocation, smoke inhalation, sudden infant death syndrome, choking, motor vehicle collisions, drug or alcohol overdoses. And so we'll talk a little bit more about each one of these. Okay, difference between adult versus child CPR, and I'll lean on President Gardner's expertise on this too. So if it's under 1 year, you don't go as deep, obviously, with chest compressions. Now, for a kid, it's a little different. So I'll pretend like this is a baby, okay? You can use 2 fingers instead of having to do, obviously, like this. You're not going to do this to a kid, right? You're not going to do this to a kid. You can take that kid and you can use 2 thumbs and press down 1.5 inches. Or you can use 1 hand and do CPR. You're not going to do this on a little child, okay? Differences 1.5 inches versus 2 inches in depth. Again, you're still doing 100 to 120. You're still going that fast rate, right? Ha, 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 staying alive, okay? Both require, and again, both of the 30-to-2 ratio. And that 30-to-2 ratio is 30 compressions to 2 breaths, okay? And again, if you're not comfortable doing breaths, that's okay. Just do chest compressions. That's fine. Infants are usually more of a respiratory arrest, whereas adults are more of a cardiac arrest. So in kids, it's a breathing issue. Okay? If alone, you want to provide 2 minutes before getting help in infants. In adults, we don't care about you as much, so you call 911 immediately and then provide CPR. But in kids, you want to start CPR right off the bat before you try and get help. Okay? Pulse is brachial in infants. That's in the arm. It's kind of tough in kids to feel a pulse sometimes, but it's usually in the arm is where you can feel it the best. Okay? Adults, it's the carotid. Okay, up here. Okay, and that takes some practice. It really does to feel that. We're doing CPR, and when they come into the ER, we're doing a lot in the groin is where we're feeling the pulse a lot of times, but up in the carotids is pretty difficult sometimes, and it takes some practice. So if you want to do it, don't do both at the same time. But if you want to do practice on yourself, go ahead and do some practice on yourself. Don't push too hard. Okay? Brother Gardner, anything to add to that? Okay. Questions? Yes?
Will you show where in the brachial again?
Brachial is an inner arm.
Is it into the pit?
No, it's not that far into the pit. No. And again, it's feeling around here. It's more. It's down about 3/4 of the way down. Yeah. And in kids, you can feel a lot better than on yourself. I can feel mine right now, actually. So yeah, it just takes some practice. So right about there in me, but anatomy is different in everybody. So again, you're going to be feeling around and trying to get an idea of where it is.
If a kid's not breathing and fluid in front of you, most of us can't feel the pulse. You can't feel anything. You can hardly see straight, so just start CPR.
Yeah, those are not good times. In fact, I took my boy to Cafe Sabor the other day, and we were eating. We were sitting there, and I see this. He's probably 8 months old. Is a little Down syndrome kid, cute little kid, And somehow he got a chip, and he was chewing on a chip. And I see him all of a sudden start to choke. And he's doing fine. He's coughing quite a bit. His dad picks him up and is patting him a little bit. And then kid's kind of struggling a little bit. And then his mom grabs him, and she's patting him a little bit. And then all of a sudden, worst feeling ever. I see the kid just head go down. So I jump up and I grab the kid. And in kids, when they're choking, and he was small enough, is what's called the football hold, right? So I grabbed him like this, laid him down, and I gave him 5 big smacks on his back. He came to right afterwards. I saw him wake up a little bit. I kept him down a little longer, and so he luckily he came to relatively quickly, because that's the worst thing ever when you have to start CPR on a kid. But he came to. His mother decided to come over with this gigantic fingernail and stick her nail in his mouth and say, "Oh, I need to get food out." And I said, "Ma'am, no, don't do that, please. You never do a blind finger sweep on a kid. Never do a blind finger sweep on anybody. Okay? You don't ever stick your finger in there and dig. You're just going to push that further into the airway is what you're going to do. And especially in kids, that's the worst thing you can do." So she had this giant fingernail and just probably just scratched the crud out of his throat. So after that, he was up and eating, but you could see he was kind of wincing every time he'd eat something, probably because he had this giant nail mark in his throat. So again, for choking, check for safety. Again, that's the most important thing. Weak or no cough. These are some of the symptoms you're going to see. A high-pitched voice, what we call stridor. If you hear a he, that's an obstruction. You hear that in croup kids. You've probably heard of a croup kid before when they're coughing real bad. That's that upper airway that becomes constricted. Same with if you're choking on something. That's something stuck in the upper airway. Pale or blue color, unable to speak, cough, or cry. They're like this. They're panicked. They don't know what's going on. Holding throat with 2 hands obviously is the universal sign that you're choking. So good. That's good advice for you guys as well. If you're choking, I'm choking, okay? That's the universal sign, because you're not going to be able to say, I'm choking. You're going to be like this, okay? Because you can't speak. So adult, kind of the same thing. It's those 5 back blows, okay? Boom, boom, boom. If you can kind of have them bend over a little bit, and it sounds mean, but you're smacking them pretty good. You're smacking them pretty good on the back, okay? Heel of the hand right between the shoulder blades. If nothing, then the Heimlich maneuver, right? Everybody's heard the Heimlich maneuver. So the Heimlich maneuver is ball in a fist, okay, right at the belly button, and then upward thrust. So with the other hand here, and you're going up with that, okay? It's not so easy to do on a mannequin. But upward thrust, and you need to do 5 of those, and again, pretty forceful. You're kind of yanking on that. If they're a bigger person or a pregnant lady, back blows may be your only option, okay? So, infants, we talked about that, the football hold with the back thrusts, and then again, never do a blind finger sweep, okay? Questions about choking? Yes? Oh, wait for the microphone. I think they wanted on the, sorry.
What pace do you do the 5 abdominal?
So I would do 1 and then just wait a minute to see if that brings it up. If not, then just go right at it. Probably every 3 to 5 seconds. Probably every 3 to 5 seconds. Yeah, Eric?
So my question is you said never do a blind finger sweep.
Correct.
So if you can see the food in their mouth,
Different.
then you try and grab
Different.
it?
Yeah, if you can see it and you think you can pull it out, obviously that'd be beneficial. That'd be beneficial. If it's seen and you can pull it out, great. If you think you're gonna pull it, if you're gonna shove it back in there by reaching in there, don't. Just keep doing those finger thrusts or keep doing those Heimlich to try and get that out. Yes?
What if you're alone?
So tables sometimes, if you go up to a counter and you can kind of do that thrust yourself on a counter. I'm not going to show that, but if you kind of thrust on a counter, that would be one thing to do. And if you can kind of do to push up on that diaphragm to expel that out. Yeah, it's tough. I've choked before on something. Luckily, I was at the hospital. I did my own way of taking a nitro pill and then drinking some Coca-Cola and got it out. So, yeah, it's tough when you're alone. Yeah, just try and get to help as soon as you can would be my other advice. If you know somebody close by, run and get help. But yeah, if you can kind of get on a counter or something and put that force on your stomach to try and get it out.
So for this Christmas, I bought each of my children one of those choke things that, you know, that you can push down and pull up.
Oh.
Really cool.
No idea what that, like a plunger?
Yeah.
Yeah, it's really
It's
cool.
an accordion.
Anyway, my husband thought that was the dumbest Christmas gift. But my kids, when they opened it, they were all excited to have that because they have young children, and you know that's a huge concern all the time, the choking with young children.
Cool.
So,
I've never heard that.
I would be without it.
Yeah. Okay. Very good. Very good. Okay. Choking. Any other questions? Okay. So I brought a first aid kit. We'll talk. Yeah. Go ahead.
Anatomically, is there anything on the back walls that you're trying to? Are you trying to get to the diaphragm, or is it just?
No, you're just
dislodge
trying to
it?
expel that. Yeah, you're just trying to get that out. You're just trying to get that out. So that's why it's between the scapula, and you're just smacking that, trying to get it out. And that's why I say if you can kind of lean them over a little bit, you know, so kind of gravity, it'll follow gravity a little more. If they're sitting upright, it's kind of hard to do that. So if they're over a little bit, you know, that might help. Obviously, you never want to pick a kid up by their ankles or anything like that. You know, try and do the football hold if you can, but you're not picking them up upside down and smacking them. You're trying to get them down. If they're small enough, you can do that. If it's a child, like a, you know, then you can just do the back blows. You can just do the back blows. Okay? Other questions? All right. First aid kit. Like I said, I bought one of the, I don't know where we got this. I think it was like Costco or something like that. It's got all the things in here, but I just wanted to talk about some of the important things to have in a first aid kit. Obviously, you want some bandages, various sizes, some sterile gauze pads, an ACE wrap. A tourniquet is not anything, I mean, that's in like an extreme cases, and it's very rare, and I'm gonna emphasize this, it's very rare that you're gonna ever put a tourniquet on, because that is, unless there's limb is gonna be gone, you're not gonna use a tourniquet, because most of the time, a tourniquet comes into us, that limb's gone. That limb's not gonna make it, you know, if they have a tourniquet. Unless it was put on correctly or quickly, and they get to us quickly, that causes massive ischemia. That limb usually does not make it. So tourniquets, I put that on there hesitantly. Just be wise, I guess. Some of the medicines that are over-the-counter medicines that are important to have. Obviously, antibiotic ointment, Benadryl, Pepsid. You're probably thinking, what? Am I going to get some? Yeah, just because I got some GERD. No, Pepsid. Benadryl works on histamine 1 receptors. Pepsid works on histamine 2 receptors. So you're slamming all. Sometimes we give people Benadryl, they don't react. I give them Pepsid, that allergic reaction goes away. So that's over the counter. So Pepsid is one that you can get that'll help with any kind of an allergic reaction. Benadryl, Pepsid, Motrin, obviously for pain, and hydrocortisone cream or ointment can be used for rashes. Obviously, and those are kind of the biggest medicines. Other than that, I don't think you're gonna, you know, from a use standpoint, I don't think there's any other medicines that you're really gonna need. Antiseptic wipes, alcohol wipes, non-latex gloves, some kind of a breathing barrier if you're going to give CPR to somebody you don't know, scissors, tweezers, and an instant cold pack and tape. Anything else I'm missing from that list that anybody can think of?
I would say that the scissors, what are they called? They have the crooked end.
Bandage scissors.
Yeah, I don't
You know what I'm talking about?
Yeah,
They're
bandage
scissors all the
scissors.
time.
Yeah,
Well, like
bandage
EMTs carry
Yeah.
to cut clothes
Yeah.
off. Yeah.
We call them trauma shears.
They'll cut seatbelts and
Yeah.
everything off.
We call them trauma shears because we cut through
Trauma
pants. And,
shears, that's
yeah,
it.
trauma shears. And so, yeah, those are important to have, you know, and if always important because you can make a tourniquet out of pants too if you need to, or some kind of piece of clothing if need be. Yes.
So I just have a question. My husband backpacks a lot,
Yeah.
and he's in the backcountry, and he's kind of weird. He doesn't want to take like everything.
Mhm.
Is there anything in your opinion that is like, hey, if you take nothing else, take this with you?
This would be my list.
Oh,
This would be my list. Yeah, this would be the bare minimum list that I would take because this you can pretty much do everything with. So this is my bare minimum. Yeah, you could add a lot more to this list, but this would be the bare minimum that I would suggest. And that you could put it in I mean, you could put it in something like this. It doesn't have to be very big. You know, you could fit all that. I mean, you don't have to take a ton of bandages. I mean, the more the merrier, or gauze pads. It's just hard to know. It's better to be prepared, I guess, in case something bad does happen, especially when you're hiking out in the middle of nowhere. Okay? Other questions about that? Okay. So let's talk about bleeding. Number one priority in bleeding is to stop the bleeding. So that would be applying direct pressure to the area. Now there's obviously different kinds of bleeds. There's a venous bleed, which is a slow, usually not too terrible bleed, or a arterial bleed, where it's spurting with the heart. And so obviously two different types of bleeds. Doesn't matter what it is, the idea is to stop the bleeding at all costs. So you apply gauze to that area and direct pressure. And when I say pressure, again, like everything we've talked about today, it's kind of barbaric. First aid, all this stuff is kind of barbaric. You're putting some big pressure on that area to stop the bleeding. If you can elevate the area, obviously that'll help too. If it's an extremity, if it's a leg, you want to get it up above the level of the heart. If you can elevate that area, that will slow bleeding. Yeah?
Can you address Israeli bandages?
Israeli bandages? I have no idea what that is.
You don't?
No, I'm American.
Yeah,
What are?
no, Israeli bandage is a bandage. An Israeli bandage is a bandage that is like those long elastic bandages, kind of, but it has you wrap it so far and then you turn this thing and turn it.
Yeah, it does like stitches for you.
Well, no, it just adds a little more pressure.
Oh.
It's not like a tourniquet, but it adds more pressure to help stop the
Oh.
stitches. And then you can wrap
It's
it.
like a pressure dressing that you
Oh.
put on
So it's a combination that it's integrated into like an ace wrap so that you can apply
And then
pressure with
tweak it.
the bandage.
Gotcha.
Yeah, that thing.
That's
All right, I'm an ER guy. We don't use that.
I mean, yeah, they're not available. They really are.
Yeah.
I've never seen any.
They've actually got
company produce them.
They've got some actually really cool stuff that they can use in the field too, where they actually inject something into a wound. If it's a penetrating wound, that is actually a clotting foam that'll fill up and stop the bleed too. So there's stuff out there that we just don't use. Yes.
I was an EMT in the past, and
Yeah.
I trained some Israeli bandages. Really good in the field, like President said, it's a pressure bandage, really quick, but not quite the same level of pressure as a tourniquet. So they are nice to have. And you can buy them in town, you know where to look.
But so again, biggest thing is direct pressure. If those pads get soaked with blood, don't take them off. Just apply other bandages on there. Okay, keep applying bandages and pressure until that stops. The tendency is to go, oh, let's see what's happening. Blood comes out. Just keep pressure on there and apply pressure over and up. Apply more pressure. Again, tourniquet only if life or limb threatening. Very rare that you want to use that. Belts can work, things like that. But that's again in extreme circumstances that we're using a tourniquet. Don't use any hydrogen peroxide or betadine on deep wounds. Obviously, try and keep it as clean as possible. But don't be pouring anything into those wounds if they're that deep. And again, great advice is keep the injured person calm. If you're getting ramped up, your blood pressure goes up, you're going to bleed worse. Things like nosebleeds, if you can pack those, pressure, ice is always important sometimes. Obviously, you don't want to put ice in an open wound, but ice on the bridge of a nose and the nosebleed sometimes can kind of slow that down. Afrin is a medication that's over the counter, is a vasoconstrictor. So you can use some Afrin in a nose, and that'll kind of constrict those capillaries and help with the nosebleed. So if you're prone to nosebleeds, you can take some Afrin as part of your medication list as well. Okay? Questions about bleeding? Don't bleed. Don't bleed.
What's a deep wound?
Anything you're not comfortable with. Anything you're not comfortable with. Deep wounds, I mean, I would never use hydrogen peroxide or anything like that on any kind of a wound to begin. I mean, a superficial wound, we go through layers of skin, right? If it's superficial on the skin itself, like a laceration that you think can be easily closed, if you're seeing tendons, muscle, bone, that's a deep wound. That's a deep wound. That's what I would classify as deep. Make sense? Okay. Okay, let's talk about bites. Different kind of bites out there. Wash the area with soap and water, obviously depending on the bite. So unfortunately, we see a ton of dog bites. Please, if there's a dog fight going on, use your foot. Don't stick your face and your hand down there. Like, don't try and break up a dog fight. I see so many people come in with just horrible, disfiguring dog bites to their face and to their hands. Just don't do it. That's just my soapbox. So but some of those are deep. So again, I wouldn't pour anything into any of those. We clean them out when you get to the ER. We start you on some antibiotics called Augmentin, or what we call Dogmentin. So we give you the medicine to kind of treat that. Okay. Apply cold compresses to those bites. If there is a bite, that can kind of help reduce swelling. That can control bleeding. Again, elevate it. You can use hydrocortisone or calamine lotion if they're like bug bites. Again, if they're an open wound bite, I would not use hydrocortisone cream or calamine lotion on those. I'm only talking about like bug bites or things like that are superficial. You can take an antihistamine like Benadryl, cetirizine, Pepcid, any of those, that'll help. If it's a sting, don't try and grab that stinger because you're just going to put that venom right in the wound. So try and flick it off, or if you have tweezers, try and get the very bottom of it and get it out. Don't squeeze that stinger. And again, do not try to suck the venom out. That's kind of an old wives' tale. You're gonna be the second patient if you try. There's no way. So if you think about it, if you go get a vaccine, so you're gonna go get your shingles vaccine, and they inject you, you're gonna try and suck out that vaccine that was just injected into your arm. You're not gonna get anything out. Just like a bite, you're not gonna get anything out. If there's a bite there, you're not gonna get any poison out. You're just gonna get it into yourself. You need to spit it out. Chances are you're gonna infect yourself more than anything.
I was just going to add on the dog bites. If this is a situation, we're talking some situation where you're not getting these into the ER, you're managing this at home or out on a camping trip, we do not close these. We don't sew them up or glue them shut. We leave them open because they're such high risk. That's why we put them on antibiotics. I've seen a dozen kids who their dads have been to a really great presentation at the church on first aid, and after their kid gets bit by a dog, they think I've got super glue out. This is just a small cut, and they close those things up and super glue them shut. And those kids end up back in the hospital getting drains because these have to stay open and drained. So unless half your face is falling out, then we'll kind of stitch that up a little bit. But we leave the bites open to let that infection.
Thank you for saying that. Horrible infections, especially on extremities. If there's bites on the hand, I've seen the worst, especially cats, the worst what we call cellulitis, and that gets tenosynovitis or an infection in the joint itself. They are awful infections. So yeah, thank you for bringing that out. Please do not sew those up. The other thing that you brought up too, if you've got super glue or any of that stuff at home, please, if the wound is bleeding that much, do not apply super glue to that. You're just making a giant mess. Okay, if it's bleeding and the bleeding is not controlled and you're trying to rub super glue on there, it is awful to clean up at the ER as well. I have to scrape all that glue off. The wound is still open because it's draining still. So the bleeding has to be controlled if you're planning on using any kind of a glue on there. Okay, just be careful of that. Okay, any other questions about bites? Obviously, we don't want to see big bites or, obviously a different animal. No pun intended. Yes?
I'm sorry, I was just now thinking, so like a dog bite where it's or even a bear bite where it's a puncture, you treat that like a puncture with an
Correct.
You would want to cover that,
you could cover it with a gauze or something like that, but don't put any ointment on it.
Clean out, right?
Yeah, you don't put any ointment on or anything, and that's why I said you're not sewing that up because you're just trapping that bacteria in the wound.
Do you still try to clean it though?
You can clean it, yeah, you can clean it. Again, depending on how deep it is.
So
if you see tendons,
put a light bandage on it and get them to ER.
Correct.
Okay.
Correct. That would be my advice. Other questions? Yes.
You had mentioned antibiotics, and I've seen on some questionable You mentioned antibiotics, and I've seen some questionable advice. Since antibiotics are a controlled substance. You can't just get them.
Correct.
You have to get prescribed. But in those prepper scenarios, I've heard that you can get the same antibiotics from pet stores for fish aquarium antibiotics. It looks like it's the exact same thing. Now, the measurements and what you need, I don't know, but I don't know if that was like a fake thing, because antibiotics are important. Like with Hurricane Katrina, there was a lot of people that died just from simple infections that antibiotics could have fixed, and that's not something that we can stockpile.
Sure. I would just go see a doctor. Go see a doctor. You should be able to get it prescribed to you. I would not use pet antibiotics.
Aquarium medicine.
I had a guy come in the other day, decided to use his horse steroid. Didn't end up well for him. He went into kidney failure. So you got to be careful what you're using. So the doses, like you said, the dosing is different. You just got to be really careful with the antibiotics that you're using and use them.
Okay.
Just be careful. I wouldn't use any animal. That's just my 2 cents. Because hasn't worked out well for people that have done it. Just because, just direction from under a doctor if you can. Okay? Other questions about bites? Okay. Burns. Burns are horrible. So, obviously you want to remove the heat source. We are a burn center at one of the hospitals, and so unfortunately we see quite a few burns. What you can do is you can, again, depending on the deepness, now there's different kinds of burns as well, just like wounds, superficial burns. Now, on superficial burns, meaning you don't see flesh underneath there, you can see a red spot or maybe even some mild blistering. You can immediately run cool water over the area for 10 to 20 minutes. If not water, then if you're out camping or something like that, you can use a cold compress. If there's skin opening or anything like that, don't run cool water over that, depending on the thickness of that burn. These are superficial burns. Obviously, you want to remove jewelry or tight clothing. If it's a hand burn or something like that, try and get that ring off there as soon as you can. Obviously, if skin comes with it, you got to be careful, but you want to try and remove that because that area will swell like crazy, and that'll constrict things. So if you can get jewelry or anything else like that off there, that would be ideal. You want to cover it with a loose, sterile bandage. Again, don't apply ointments immediately, like whatever you use, butter, oils, because that can trap the heat in. Okay, so don't just cover it with a bandage and get to a burn center or get somewhere else where you can get that taken care of. If there are blisters, do not break those. Immediately let those go. Let wound care take care of those. And some rules of thumb: if the burn is larger than the hand, if it's on the hand, face, feet, groin, or major joints, get help right away. Okay, because those could be pretty serious. Those can limit movement. Obviously, there's airway compromise. There's other things that can play into that. Yes.
So it says don't use ointments or anything like that. Can you use like lidocaine spray to help numb it or anything?
I wouldn't right away. Again, depends on the depth of that burn, but I wouldn't spray anything on it right away. Again, the whole concern about burns is, right, your skin is your barrier for infection. Your skin is your barrier for infection. So if you can just keep that clean until it gets seen, you come to the ER, most of the time what we do is just put a bunch of ointment on there, but that's usually a while later. We're not putting ointment on there right away. Usually it's quite a while after the burns are taken care of. So there's different kinds of burns, obviously. There's an electrical burn, there's grease burn. So we've got to clean that wound off, get that heat source removed, and then take care of the wound. And so I would try not to. I think it's fine to take something like a Motrin or something like that for pain. That's a good anti-inflammatory. That's something that I would advise more as opposed to spraying it with anything. Yeah.
Nate, would you use burn cream? Most of the time, my kids, it's like a poker, roasted marshmallows, touching that, touching a cookie sheet, things like that. Yeah. Small stuff like that.
Yeah, if it's small stuff, I think you're okay with that. Again, depending on how deep it is. Again, I just be careful what you're doing. If you're getting a big blister or if it's over a joint, even that distal joint of the finger, if you get a burn in there, that can restrict movement in your hand. So if it's the tip of the finger, usually those are you can take care of those usually pretty well. Ointment, things like that, keeping it clean. That's obviously, again, the barrier for infection. So you can just prevent any kind of infection. That's most important. Really, Garner, anything to add about that? Okay, questions about burns? horrible, horrible. We see way too many people, decide to smoke and with their oxygen, blow their face up, and just burns everywhere. And so burns are not fun to take care of, and they're pretty serious, and they can be pretty life altering. Yes.
So like second-degree burns, you would go to the hospital for those, would you? There be some really bad ones.
So we get calls all the time in the ER. Can you give me advice? I would go off what you're comfortable with. I can't give it. I wouldn't give advice. I would just get it checked out just to be safe. I'd at least go see your doctor.
When we go camping, it's like burns on the motorcycle.
Depends on where it is.
Four-wheeler, burns in the campfire, burns around cooking, things like
that. Depends on location. Depends on where the burn is. Again, if it's over a joint, if it's on the hand, if it's on the face, genitals, anything like that, I would get it seen. I would get it seen. Yeah, if it's somewhere else, that fingertips, maybe on the thigh or the lower leg, probably not much they're going to do about that. But I would and again, the size of that too, depending on how big the burn is. If that burn is larger than a hand, I'd get it looked after. That's really going to increase your risk of infection.
Thank you.
Yep. Yeah.
It says run cool water over area. Or a cold compress. Mm-hmm. Is ice advisable?
Ice is okay. Yeah, if you've got nothing else. I'd do some cool water. I wouldn't do ice cold water, but some cool water would be just fine. Just kind of like a regular temperature. I wouldn't do anything too extremely cold. But if that's all you have is some ice, that's not going to hurt either. Again, depending on the severity of it. If it's a superficial burn, ice will really soothe that and make it feel better. Yeah. Okay. Other questions? Okay, very good. All right, fractures, dislocations. So that's what this is. This can come in some of your, this is kind of cool. It's a little flex splint. If you open this up, it's kind of a firm splint that you could put on an arm or an ankle or something like that. Even ace bandages will work. But immediately you want to immobilize using a splint or sling. If you're out in the woods, you can get a stick. You can get a piece of wood. You can do a folded newspaper, something like that you can kind of keep that area immobilized and wrap it up with an ace wrap. Most of the time we're seeing wrists, right? If people fall down, hands out, what we call a foosh, a fall on outstretched hand. That's a foosh injury, and they have what's called a compression fracture. And so right here so wrist obviously immobilized, put a splint on, wrap it up. Okay. Dislocations, depending on how comfortable you are, typically don't try and reduce those yourself. But if it's a shoulder or something like that, you're familiar with it, you can maybe tug on the shoulder a little bit. We have a maneuver that we use where we have I don't know if I should sit on that table, I'll sit over here. They sit down, we have them sit down like this, and they put their arms like this, interlock their fingers, and they put it on their knee, and they put their head backwards, and now they usually pop their shoulder right back in. So that's something you can do if you know it's a dislocation, but I would suggest just getting it looked after. Fingers are pretty easy to if they dislocate, you just have to pull it out and move it over because it's sitting on a little perch there. But again, probably just put it in a splint and seek medical help. Everybody's shaking their heads like, I'm not doing that. I'm not doing that. So again, try not to move the joint would be most advised. If you're out in the middle of nowhere, maybe something that you have to do. Apply ice 15 to 20 minutes. People always keep the ice on there forever. And when I say ice, anytime I'm talking ice, I mean it's got to get cold, right? It's got to sting a little bit. You can't do 4 towels and then the bag of ice on top of the 4 towels. It's got to be cold. It's got to sting a little bit, and just 20 minutes. Any more than 20 minutes isn't going to do squat. But if you can ice it for 20 minutes at a time, 3-4 times a day, that's ideal. That'll help control swelling. Again, elevate that area. If there's an open fracture, obviously you want to control the bleeding and immobilize. If it's a neck or back, immobilize. That's what these are. This is a C-collar that you strap on like this so they're not moving their neck at all. You can kind of make your makeshift C-collar if you don't have one of those, but just try and keep that neck as still as possible. Okay, do not move that neck. That's a big one. Okay, questions, fractures, dislocations. Yes.
I do. What if you're out, like I said over here, in the mountains and something like this happens? Immobilization.
Immobilization.
You run or find someone.
Immobilization if you can, and again, in extremes, you've got to do what you've got to do, right? But trying to mobilize that area as much as possible, if you can. Again, hopefully it's nothing big. If it's a fracture of a leg or something, that's obviously something pretty darn serious. Trying to get help. If you have them go get help, you're not going to be able to move much. It's immobilization of that area as much as possible. Yes?
How about shock? When a person breaks a leg, they go into shock. What can you do there?
Yeah, it depends on the severity of shock. So there's different types of shock. It just depends on the type of shock they're in, but just try and keep them calm. You can try and warm them, get a blanket on them. That's something, especially with fractures and stuff, they will go into shock pretty easy. Try and keep them warm, try and keep them calm. It depends on the type of shock. So shock can lead to certain things like cardiac arrest. So if they obviously go into cardiac arrest from the shock, then you're initiating CPR. But there's really not much you can do to stop shock other than control the bleeding. If they're losing a bunch of blood, that can be a hypovolemic shock is one of the shocks. When they're low on blood because they're bleeding out so much, you're going to try and control the bleeding. And that's one way to stop the shock. So there's different types of shock and how to treat them, but sometimes that ball's rolling. It's hard to stop. There's nothing really that you can do to stop the shock other than control the bleeding, calm the patient down, things like that. William Gardner, any more? Okay. Other questions about fractures, dislocations? Okay. Lovely. Okay. Stroke. So this is something that's vitally important. So what we call be fast. Okay. So balance, eyes, face, arm, speech, and the most important one is time. So there's two types of stroke. There's ischemic, which is a clot, and that's 87% of strokes. The other one is hemorrhagic, or a bleed. So let's go over these. So balance is the number one thing. So if you have a sudden dizziness or loss of coordination, I actually hate the word dizziness. People come into the ER, they say I'm dizzy, and I'm like, what is dizzy? Like, you've got to define dizziness for me. So unfortunately, I have it up there, but I hate the word. But any kind of sudden dizziness or loss of coordination could be a sign of a stroke. Eyes, if they're blurred or there's double vision or vision loss, typically it's one or the other. It's not both. It can be both if there's a hemorrhagic stroke, but it's pretty rare. Ischemic stroke is usually one side or the other. And it's what's called contralateral. So if I have a stroke over here, I'm blind in this eye. Okay, so it's contralateral how it works. Face, if one side of the face droops or is numb, right? So if you have this and you're slurring your words and you're confused, get to the ER immediately. Okay? Time is brain. Time is brain. Okay? We have amazing things that we can do there. So we have clot busters. I have seen this multiple times that somebody comes in and is having a stroke, a giant stroke. They're unconscious. Their face is drooping. They can't talk to me. They can't speak. We send them over to interventional radiology. They give them a clot buster, and that patient walks out of the ER fully functioning. Okay, within 4 hours. It's got to be within 4 hours. Sooner the better. If it's as soon as you see it, get to the ER. Do not mess around with it. Go to the ER immediately. 4 hours is kind of they've kind of extended that a little bit on some bigger clots and things like that. But the quicker that you can get them into the ER, the better they will do. Typically.
Does every ER have that?
No. Well, yeah. They all have clot busters, yeah. But ERMAC is the stroke center. So if you're having a stroke, the ambulances will take you to ERMAC. IFCH does do some clot busters, but they'll probably transfer you to ERMAC after they stabilize you or give you those clot busters. I would recommend going to ERMAC right away. Okay. Arm. So one arm drifts. So when I'm doing my exam on a patient and I say, put your palms up, close your eyes, and one of them goes like this. Okay, that's a sign of a stroke. If there's weakness on one side of the body or the other. Speech, slurred or trouble speaking or understanding. Some of them, they try and formulate words. They're trying to speak to me and they're getting frustrated and they say, and they can't formulate words. Okay, get to the ER right away. Again, time. Every minute counts. Time is brain. The quicker that you get to the ER, the better that your outcome will probably be. Okay? Questions about strokes? Yes.
So strokes typically occur in the brain?
Correct.
So what about the lungs and the heart or other parts of the body?
No, so usually, okay, let's talk about that. So stroke usually happens in the brain, and that's a clot usually that happens. So most of the time it's from what's called like an irregular heartbeat. Okay, you can get what's called atrial fibrillation, right? So your heart has two upper chambers called atria and two lower chambers called ventricles, right? So this is the normal heart, lub dub, lub dub, lub dub. Okay, that's how our heart normally works. In atrial fibrillation, the heart goes like this and it quivers. Okay, when that happens, a clot forms. Okay, and that clot then gets sent down to the ventricles. The ventricles squeeze and it goes up into your brain and causes a clot. Okay, that causes a stroke. And so if you've got untreated atrial fibrillation, that can raise your risk for a stroke. That's why they put you on a blood thinner.
So how long will a stroke last?
Depends. So it just depends on the severity.
So it can be ongoing.
It can be ongoing. Typically, no. A stroke, it depends. If it's a clot, it just depends on the severity of it and how big that clot is. It can last, for a lifetime, I guess. The clot's always going to be there. You know, if you've had a stroke, it causes damage to the brain. So what a clot does, it's fine. So you've got all these arteries in the brain, right? That clot causes an occlusion, so the blood past that clot doesn't get to that part of the brain, so that part of the brain dies. Okay? So a stroke will last forever unless we treat it within 4 hours and give you a clot buster and open up that artery, and then you're perfusing that part of your brain.
So it takes about 4 hours for the brain to die?
I would get in quicker. I would get in quicker. The quick as you can. I'm just saying 4 hours is usually that's our time frame. If it's after 4 hours, clot busters can cause more damage than good, and so we typically don't give them, I think it's 4 to 6, maybe sometimes up to 6 hours, depending on the size of the clot. We typically do not give the clot buster after that because it can cause some other damage, because there's been this ischemia or dying of the brain in that area. So the quicker the better. So atrial fibrillation can raise your risk. There's what's called a PFO, or you have like a patent foraminal ovale. It's a part of your heart that from birth didn't close, and so that can form clots. There's multiple things that can form clots. High cholesterol, you get plaque in your carotid arteries, and that breaks off and goes to your brain. Okay, there's multiple things that can cause clots, and so stay healthy. Stay healthy. Okay? Does that make sense about that atrial fibrillation? And so that can break off and go to your brain. Does that make sense? Okay. Other questions about strokes? Time is brain. Time is brain. Okay. Get to the ER as soon as possible. You start seeing any of those symptoms. EMS. Any things about stroke? Okay. Good. You saw a lot of those, I'm sure. Okay. Couple different pictures here. Anybody see what that is? Does that look normal to you? Yeah, unfortunately, this is a gunshot wound through the middle of the brain. Unfortunately, didn't do well. This is a skull fracture. So this is not supposed to be like that. That's some blood in the area there. Skull fracture. I didn't put up any of my really grotesque ones. If you want to see them, you can come talk to me later. That's a giant tumor in the brain. Here, with some bleeding and some edema around it, causes what's called a shift, and you can see everything. This is supposed to be midline, and everything's kind of shifted a little bit. What's wrong with this picture? Anybody tell me that? So this is a foot. There's only 4 bones here. 1, 2, 3, 4. Where'd the 5th one go? It's underneath it. Yeah. So that's a dislocation. There's a fracture dislocation, ended up being underneath this bone, so we had to pull on that and get it in the right spot. Kind of cool. It's kind of cool, actually. I was like, where'd the 5th metatarsal go? Okay. This is a guy loading his gun. Went off in his hand. Okay, kind of not too bad on the bone. You can see the bullet fragments there. Fired off in his hand. Okay. Questions about anything? Yes?
That's a good source to be able to
The American Heart Association. The American Heart Association.
Or
First aid.
everything.
Yeah, they've got everything. American Heart Association will do CPR. They'll do wounds. They'll do first aid kits. The American Heart Association is trusted and well respected, and will have all that information for you.
Just go to their website.
Go to their website. Yeah, yeah. And again, I would recommend, if you can, go get CPR certified. I think it's.
And where do you do that?
You can actually do it online nowadays. You can do it online, but there's certain pieces. You can even call the hospital. They have classes that they'll still do in person. But yeah, if you can go in and get that done, I would highly advise that. Yes.
Okay, I would just encourage everyone to make sure their tetanus is updated.
Yep. Yep. Yeah, we don't see much tetanus here. That's another. Let me educate you on that one too. We don't. They had a tetanus in a bat, I think, last year or something like that. But dog bites, cat bites, there's never been a documented case of tetanus. Everybody always comes in and freaks out, think they're going to get tetanus from a dog or a cat, unless that dog is rabid and you know. I'm talking rabies. Sorry, I got it mixed up. Rabies. Tetanus is good too. Rabies is one that everybody freaks out. Like dogs, cats usually don't carry rabies. But yeah, please update your tetanus for sure. And that's when you get a dog bite or something like that too, go get a tetanus shot and make sure that's updated every 5 years. Okay, other questions? So please come up, and you're welcome to try the mannequin. I don't know why the lights are on. I haven't read the instructions on how this thing works, but I can tell you if you're going fast or not. And so you can come up and try that. I've got some plastic bags here that you can put a hole in. You can kind of get an idea of the first aid kits. Sister Grimes brought some first aid kits here too that you can look through, and some of the things that you can work on for your own first aid kits at home. And yeah, I think that's it. Any other questions for me?
Thank you.
Okay, thanks. Okay.
Thank you. We can make this PowerPoint available too. He emailed it to me so I could distribute it. I don't know the best way other than just find my number, John's, Nathan, right? Text me, email me, or whatever. I can send it to you if you're good with that.
Yeah, absolutely.
So.
And if you have any questions, you can email me as well.
Yeah. Okay. One thing that I will mention is I found out just a few nights ago that our previous presenter, he went to a mutual class at one of the wards. So, you know, I don't know, but I bet Nate, if you're looking for activities, Relief Society, you know, or others, I bet he may come do something similar. So just another idea there.
I can share some of my more grosser pictures.
Right? Oh yeah, I'm dying to see those.
No, you're not.
Pass that. There was one more thing. Oh yeah. If you felt something or heard something in your mind, we just want you to act on it, right? It's probably the Spirit saying, "Hey, I should go check on that. I should maybe go check out that class, or I should maybe go to that website." We just want this to be proactive, right? So we'll just end with that, and I'm gonna have my lovely lady say the prayer to end it.
Dear Heavenly Father, we are so very grateful for the ability to come here tonight and to be edified. We are so grateful for the sacrifice of Brother Boyle, and that he would take so much time to present this information for us and help us to understand how better to take care of ourselves and those around us. We're grateful for the area that we live in and that has so many resources and abilities around us. We're grateful for thy church and for the talents and abilities that are shared on our behalf. We pray that thou would help us to help others around us and to become more prepared. And we say these things in the name of thy Son, Jesus Christ. Amen.
Amen.
All right, you ready?